So, hi guys, and thank you very much for joining me. Do you want to introduce yourselves?
Yeah, my name's Fiona, and this is my husband Ismael. We're both GPs who trained in Glasgow in Scotland, and we decided to move out to Australia before we even started GP training. And it sort of became a reality about 9 months ago when we moved out to Australia.
So, I mean, Australia's a huge place. How did you decide where you wanted to go?
Well, we had a few different ideas ahead of moving out. I think, like just about any other doctor in the UK that I know, we already had friends in Australia. We had friends in a few different places, and Head Medical helped arrange some Zoom interviews with different GP surgeries in areas we specifically were interested in, and that culminated in Fiona flying off to Australia and visiting all the different practices. And from there, she decided we were moving to Port Macquarie, New South Wales.
Yeah, and I think deciding on the practice came down to a few different things. None of the practices I visited or we had chosen to go and see were bad options, but a lot of it came down to location from a family perspective, because we have a now 6-year-old and now 3-year-old. So a lot of it was what felt right from a work-life balance and a family perspective, alongside choosing a practice that felt a good fit for us as a couple, because we both work in the same place.
And so, when you've gone out there, do you live quite close to the practice?
Yeah, it's not the biggest town.
No.
People will complain about the traffic, but the traffic is maybe 10 minutes driving.
Yeah.
Coming from Glasgow, that's not that big of a deal.
Yeah.
So yeah, we can walk. We certainly, when it's not too hot or not too cold, one of us walk home from work of an evening. But yeah.
Yeah, no, life is within a 15-minute radius, and that's whether it's dropping the kids off at school or going into town or going to the beach or going to work. Nothing is far away.
And in terms of when you initially got out there, what did you do sort of property-wise? Did you have somewhere lined up to rent, or did you take something short-term?
Very fortunate. So one of our best friends from university lives in the town, and lives on this street. They secured a rental for us, basically, or they viewed properties, because you have to view a property in order to get rental when you move into a property in Australia. So they found a rental for us, which they, it's a great place. And we've extended that lease, so we'll be here for up to 18 months at this point in time, at which point we are planning to buy a house. But there's different hoops you have to jump through when you buy a house if you're not got permanent residency, which we don't yet have.
Okie doke. So is that something that you're looking at, the PR route?
Yes, we are just running down the clock until we're allowed to apply, and that comes once we've got fellowship with the college and then specialist registration with
AHPRA.
AHPRA.
Yeah. So you're out of Port Macquarie, which is on New South Wales coast. So have you done much travelling since you've been out? Have you?
A reasonable amount. We have friends in Sydney. We have friends in Hobart. We haven't made it to Hobart yet, but we have a trip planned for there. We've done a reasonable amount of exploring the New South Wales coast, camping at various campsites nearby. We've been to the Hunter Valley a couple of times, which local wine area, which we really like. We're going to the Gold Coast in a couple of weeks, and we've been to the Blue Mountains.
We've explored a bit. It's been good.
That's not bad going.
I think it's easiest when family come to visit. And so my parents came out for about a month, June, July. And so it was a good opportunity for us to spend time with them, but also go and do some travel and some trips together. I said to them, I think that I've seen them more for having moved to Australia. In Scotland, I'd see them a couple of times a year because they were 2 hours away and that was too far. But if they want to come for a month, that makes it a lot easier.
I know people say that family are really far away, but actually you're not the first people that have said that sometimes you see people more because they make more of an effort and they're there for a longer period of time. So what motivated you guys to make the move from the UK to Australia?
So multiple factors in that. Fiona and I did the traditional post FY2 thing where we moved to New Zealand for a year and a half, 2016, 2017. really loved it. I took all of a week of getting home to Scotland to say this was a mistake. And I think I kept banging that drum for the next 7 years. We did have a happy life in Scotland. You know, we were happy, we were busy, we enjoyed our work and things. But I think that we'd had a familiarity with how things were in the Southern Hemisphere. Gradually saw a drip, drip, drip of more of my friends moving to the Southern Hemisphere as well. And the feeling I had was that in terms of long-term career happiness, Australia was a much more sensible place to set myself up as a young GP and plan the next 30 years of my career.
Yeah, and I think sort of alongside the concerns about the longevity of our careers, with the current climate in Scotland, just the work-life balance as well, and being able to really sort of, you know, work the hours that suited us around having young children. And then also, I mean, you can't fault the weather over here against Scotland, which again, you know, definitely feeds into it a bit.
Yeah. And did you have any concerns before you made the move? Was there anything that you were...
Yeah. You would be daft not to. I mean, I think it's a huge move, and I remember feeling nervous before making the move to New Zealand, and that was when we weren't married. We didn't own a house, we didn't have any children, we left with a few £1,000s to our name, and it was fine. But coming out here, we were bringing 2 young children. We were selling our family home. You know, it was really drawing a line under it and making a big financial commitment, because it cost a lot more money to do this move than it did for New Zealand for a number of reasons. And some of the cost came from the way that we decided to make the move. So there was huge concerns about, you know, financial implications on us as a family. You know, you're giving up a job where you're getting money, you're moving out, and for all the grass is always greener. You don't know that until the money's in your bank account and you're in the country and things are working out. And for all we have, a really good friend that's just up the road from us, again, we might have struggled to meet other people, or might have found ourselves in a practice we didn't particularly enjoy. You know, there is always a huge uncertainty, but I think, as one of my previous trainers always said to me, the only thing that's certain in life is change, and you just have to embrace it and get on with it, or you're never going to experience anything new.
And none of those concerns have come true as yet?
Nope.
The only big downside to the move is the distance from family, honestly. And that's always going to be the same for anyone that's got close family members that are left on the other side of the world. But apart from that, can't really fault anything that's progressing over here.
So make sure you get somewhere that's big enough for visitors to come and see you.
Yes. Yeah, that's the plan.
I would definitely say our experience seems to be that property sizes in Australia are significantly bigger than Scotland as well.
Yeah, you've got space.
That was a surprise for us. It just is.
I think, part of that is we've moved from a very affluent area in Glasgow to a more rural location in Australia, so prices are a bit more affordable, although it is a coastal town, so it's a very popular destination, so prices are rising here as well. As they do everywhere.
I think as well, in the towns and more coastal regions, outdoor living is more important in Australia. And when I've visited, I've certainly noticed that, you know, that people have really good outdoor spaces. In fact, their outdoor spaces and kitchens might be just as good as their actual, because you do a lot of living outside. Working as a GP, what are the biggest differences you would see between Australia and the UK?
I mean, the obvious one is definitely how the finances work, as in you have to decide how much you're charging your patient, and depending on how you're charging your patient depends on what you get paid and what your practice gets paid, what your practice nurse, you know, various things from there. And getting your head around how to bill is a huge learning curve and is probably one of the biggest learning curves. But there are courses that you can do, and I would encourage anyone that's thinking about doing this to do a course, probably not within the first few weeks. I did one early and it was too soon, but probably around 3 to 6 months into the course, when you've got into work, when you've got an idea of how things flow, would be beneficial to help optimize things and make sure that you're doing things right by your patients as well, because it's not just about the number, it's about making sure that you're getting access to healthcare funding for the patient as well from the government, and there's lots of different resources for that.
Okay. And do you guys have any special interest that you're practicing out there?
I think we've reported some special interests. Men's health and mental health have always been particular interests for me. How much that constitutes part of my day-to-day beyond what would just be normal general practice, I'm not that sure, but I do have a biography on Hot Doc, and patients occasionally bring up the things that they have read about me on Hot Doc, so I imagine some people do. I think there's an interesting system in Australia as well, where there's much more of a direct GP-patient relationship. It's less about the relationship with the practice, and it's more, I have my own list. I know that I have about 550 patients on my list, and those people would, if you ask them, who's your doctor, they'd say it's Issmael. And I think that that's also a little bit of a step change compared to what we were used to in Scotland, working in several partner practices and that sort of thing.
Yeah, it is quite nice in that you do get your own the continuity once they're your patients is really good. It can take a bit of a time to establish, obviously, as it does with any new relationship, a new rapport, and sort of get their notes up to where you need them with everything. But yeah, it's nice. I know the faces of the patients that are coming in to see me, which I didn't get in the UK.
Which is that more traditional family GP.
I feel like I don't call names in the waiting room very often these days. I walk up to the waiting room, the patient knows me and I know the patient, and I'll give a little wave.
Certainly it's the type of general practice that we probably went into training thinking we were going to get, and then it really didn't come into fruition like that in Scotland.
And it's the fee-for-service model rather than salaried in Australia. How have you guys found that, and what have the earnings been like for you? Not asking for your pay slips, but just...
Yeah, I think you can break it down in a few different ways. Certainly, you're paid more in Australia than you are in Scotland. Certainly, the tax situation is softer here as well than it was in Scotland. And the earnings are higher despite the actual patient contacts being lower. If you wanted to run an NHS clinic style service and see your 25 patients a day, you would do better financially than I probably do, but I still out earn what I did in Scotland, and I'm comfortable, and I work 3.5 days a week, and I know all my patients, and I don't feel overstretched.
Good. And the paperwork side of things, I have doctors say to me that there is less paperwork in Australia than in the UK. Would you agree?
I think it's not that there's less paperwork. I think that just more of it is captured within your time with the patient. So whereas in the UK, you would typically, speak to your patient and then you'd think, right, mentally, I need to do a referral to cardiology for this patient. I'll park that for my workload hour, paperwork hour. Here you would just do the referral during the consult, and actually in our practice, and I think a lot of practices out here, we're utilising AI with permission of patients, which actually is streamlining a lot of paperwork as well. So we have AI that's just generating referral letters based on the consultation, so that actually streamlines things. I think I still do as much in the way of admin, but a lot of it's captured while the patient's with me.
I think there's definitely a lot less back to referrer letters anyway. That's definitely one thing that I do not miss from Scotland. And a lot less in the way of repeat prescription signing as well, which is another thing I do not miss from Scotland.
Again, prescriptions all come through an appointment. You don't get a script unless you see a doctor.
And as the nature of the fee-for-service model, the service is almost invariably a GP consultation.
And so the work-life balance between the two then, I think you've kind of touched on that already.
Yeah, I think the absolute control you have over your clinic is probably the single biggest factor. Fiona is going to go back to Scotland to see some family in a few weeks, and I will work 9 a.m. until 2 p.m. I've told my patients those will be my hours. I'm dropping my kids off and I'm picking them up from school. There's been zero pushback from that. My earnings will be slightly down for it, and that's fine. But I have control over my workload and over my working life on a level that I just couldn't imagine having in Scotland.
And I think part of that is working in a clinic where we're supported by the people that took us on as well. You know, they're quite happy for us to work the hours that suit us. We both started working every day of the week, and, you know, working the equivalent of 3.5 days a week. And after doing that for about 7 months, I said, no, I'm done. I miss having a day off. I'm having a day off, and I've adjusted my hours. And actually, I think I've overall dropped an hour and a half a week because I've added an extra hour onto a couple of mornings. So you do really have that flexibility within your working week to make it suit you and make it suit the family.
It's not morning and afternoon sessions. It's consulting hours.
And certainly, I remember talking to GPs in Scotland. You can never. People talked about the sessions where you could finish in time for the school run. I never found a GP who did that. I met people who, you know, couldn't make it to their Friday prayers, despite that being hugely important to them. You've got to be able to live your life, and I felt that what I saw of more senior GPs around me in Scotland was that they were constrained in a way I didn't want to be.
And we've been able to, I mean, I guess the biggest thing of parents as well, and the things you saw from general practice in the UK, was parents never went to sports days. Parents missed the class assemblies. We've just taken time off and said, oh, we're doing that. And we've been able to make those things here, which is, you don't get that time back.
No, I mean, it's great. Absolutely. You don't get it back. You're right. And how are the kids settling in?
Oh, they're brilliant.
Yeah, it's been really good for the kids. Both of them, our 6-year-old has really come out of her shell, made a huge number of friends. It's actually been very useful for us in terms of making us be settled in, being dragged off to another kid's birthday party every weekend. And huge confidence. She goes to a lovely school. She's been really well supported by the staff and has settled in really, really nicely. She's got various extracurriculars. Joined a hockey team. She's doing something called Nippers that's starting soon, where she goes to the beach on a Sunday morning and does all of her sea safety. And our 3-year-old equally just settling in beautifully.
Oh, that's great. I think there is more extracurricular activities for the kids, and again, it's the weather thing, isn't it?
It's outdoor life. Just you'd never really get that in Scotland. I just felt it was always a little bit unpleasant to be outside. I was wearing long johns 50 weeks of the year. And maybe that's something that just seemed to happen after we came back from New Zealand. But I remember about a month before we left, our daughter, then 5, cycling home from school, crying because of how cold her hands were with gloves on. And that's just not something.
You wouldn't get that here.
No. Although she'll wear a hoodie if it's less than about 25 Celsius.
You will probably. I have had people say, acclimatise, and then it's like in the winter, you know, it's like, oh, it's getting a bit chilly here, and it's like 20 degrees.
Found myself complaining over winter, and it's been 15 to 18 degrees during the day. I'm like, this is ridiculous.
So I guess you guys would recommend people make the move if they're considering it. What advice would you give to people that are thinking about the move?
I'd say that it can feel like a really big daunting thing, but fundamentally, so much of training in the UK and things is so rotational. Moves are unfortunately just part of doctoring life, and this is a move that will actually make a big difference to the quality of life and not have you begging someone on staff for a car parking space for your 2-hour commute. I think that if you do it, especially if you do it through a company like Head Medical, you really get to just break it down in pieces and go at your own pace. There is no big rush. You can line things up. You can take 3 years to do this if you need to, and it just kind of all comes together.
There's various sort of hoops and things that you have to jump through, but it's something that's easy to navigate with support. Head Medical definitely provided us with a lot of support for that, and it's something that I don't think we would have done it differently. We couldn't have done it sooner for other life sort of reasons. But I think I would always encourage someone, if it's something that you would end up questioning later on in life, I would pause and just do it. Yeah. Right. I was just going to come back. So you had said, what advice would you give UK GPs considering a move? So I think the other thing is there's been a fairly big change in how you can move to Australia within the last 12 months. And that kind of started to come into play during the time that we were applying. We came out on the PEP specialist training programme with RACGP. And since then, AHPRA, which is the equivalent to the GMC in Australia, have brought out a new fast track pathway, and that makes it significantly easier with less hoops that you have to jump through. And as of the last couple of weeks, the Royal College of over here have basically said they're going to approve the AHPRA specialist the pathway that they're putting in place, which again just sort of expedites things for you, makes it a lot cheaper as well, and much more accessible. So even if you were thinking of just, oh, let's go over for a year and see what it's like, I don't think it's a year you would regret. And that's committing to just a year and not committing to a huge move. You know, you don't have to commit to moving over here for 5 years. It could just be let's give it a try for 12 to 18 months and see kind of thing. I think that would always be something that I would suggest. You know, it doesn't have to be a forever move if it's something that's the scary part.
Obviously, you guys used an agency. Everybody's missed that. I've just had a coughing fit. Excuse me. Would you recommend using an agency or going on your own? Any plus points?
I mean, I've spoken to people who have tried to navigate the system themselves, and who have come to me knowing that I've used an agency and I'm a few months ahead of them. Or I've had other people who have been with other agencies who have come to me and said, oh, what did you do for X, Y, and Z? I was like, oh, I just asked Carol. Carol sorted all this for us. She definitely helped us through a lot of the paperwork process. She knew the nuances of the system and was able to come back to us and said, actually, this specific thing you've done, we need to change this a little bit. That's not going to work. And we also knew our timeline, because Head Medical clearly have done this a lot. They know what they're talking, you know what you're talking about. And we knew exactly where we stood with when things would come in, and they did come in pretty much on time as expected. And for all it was stressful going through those stages and thinking, oh my goodness, is this going to work out? It all came together, and I think it probably wouldn't have come together as quickly if we didn't have your support.
Yeah, I would agree. I think that the barrier to moving would be a lot higher if you had to do all of that paperwork yourself. And the fact that everything went without hiccup, we had minimal pushback from any agencies, documents submitted were accepted, and I'm not confident that had we done that without an agency, we would have done that. And it just would have been one pushback after another, and eventually you could easily become disheartened.
Yeah. I think it is really helpful that Edge guys are experts, and the fact that they can check over all the forms and they can say, you've not dotted this I, you've not crossed this T. Yeah, it's better to do this. Yeah, it is a really good help. Also, they can navigate through all the websites and just give you the form to fill in, and you don't have to go and look for it.
Yeah. And I think just even sort of stepping back from that and just thinking to prior to when we even started with the paperwork side of things, even just looking for job opportunities, you know, if we had, you know, sat down and thought, actually, we want to apply for jobs in Port Macquarie, Hobart, Adelaide, we would have had to sit down and start trawling through job adverts, maybe start cold calling or sending emails directly to practices without sort of having sort of pre-vetted them. Whereas Head Medical helped to sort of, you know, identify job options that might be a good fit for us based on what we had described as what we were looking for. So it's kind of like you helped a bit matchmaking before we had even sort of got to the stage of even thinking about confirming a job and then all the paperwork to actually secure that place.
Well, thank you very much for joining me in your evening. And yeah, hopefully we'll catch up with you guys again in the future.
Yeah, not a problem. It was lovely to speak with you, Vicky.
Yeah, it was really lovely to speak to you, and enjoy your time in Australia.